Coronary circulation is the heart's own blood supply. The heart is very active. It needs constant oxygen to do aerobic cellular respiration to make ATP and its numerous mitochondria. So coronary circulation begins from two little vessels that branch off of the aorta, and when high pressure blood comes through the aorta, it pushes blood into that right and left coronary artery. What you're going to see is there are many anastomosing vessels in the coronary circulation, and these are just alternate routes going to one area, supplying blood to one portion. So if there's a blockage, that isn't good, but that does mean that there are alternate areas to get oxygen to that area of the myocardium. It's kind of like if the interstate is blocked, you might take a highway to get to the same area. So it's different highways, different routes of getting blood somewhere. So we'll first look at the coronary arteries. They're showing the coronary arteries labeled in red. It's just the arteries in here. Sometimes they're hard to see a difference in a figure because they lie in the same sulci or grooves in the heart. But the coronary arteries are labeled red here because all of the coronary arteries carry oxygenated blood. Again, they branch off of the right and left coronary arteries that you see, or off the aorta, and that gives rise to the right and left coronary arteries, which you see in the figure. So here's the right coronary artery and the left coronary artery. If we follow the left coronary artery, it first becomes a circumflex branch that sits in the coronary sulcus and goes around the heart. The circumflex branch supplies the left atrium and the left ventricle of the myocardium with blood. Then also following the left coronary artery, it goes down across the surface of the heart into the anterior interventricular sulcus as the anterior interventricular artery or anterior interventricular branch. Something you may definitely want to write down and make notes of. That anterior interventricular artery is commonly called the LAD, the left anterior descending artery. This one is one that is commonly occluded that will cause a myocardial infarction or a heart attack. The right coronary artery goes through the coronary sulcus on the right side of the heart. You have the marginal branch, which supplies the right ventricle with blood. And you also, it's trying to ghost it on the other side in this figure, have the posterior interventricular branch that sits in the posterior interventricular sulcus, supplying both ventricles of the myocardium from the back. Now we'll look at those same sulci contained veins. All the veins of coronary circulation are deoxygenated or oxygen poor, which is why they're blue in this figure. So your coronary veins, you have the great cardiac vein, which sits in the anterior interventricular sulcus along with the anterior interventricular artery or LAD. The small cardiac vein, which follows around from the right coronary artery and marginal branch, which drains blood from that area of the right ventricle. The great cardiac vein drains blood from the area of the ventricles from the anterior. And the middle cardiac vein sits in the posterior interventricular sulcus, draining blood from the ventricles from the posterior side. It sits in that sulcus along with the posterior interventricular artery. All of these coronary veins will eventually drain into a large vein sitting in the posterior side in the coronary sulcus called the coronary sinus. And the coronary sinus empties into the right atrium with the superior and inferior vena cava, and that drains all the deoxygenated blood of coronary circulation. So it collects the waste from the cardiac muscle.